My apologies in advance. I set up a new microphone for this computer and I did not change the default setting on Camtasia, so that means that I just recorded this entire lecture into my webcam microphone, which is across the room, which is why it sounds like I am speaking across the room. So bear with me on this one. Sorry. It's only about a 20-minute one, so I hope that it doesn't bug you too much. Here we are in the working phase part 2, where we're going to talk about interventions, which is a natural step after having talked about treatment plans, goals, and objectives. So the interventions that we're going to talk about are generally those that we will use to work through some kind of a psychological concern, mental health concern, or whatever it is. Now, we will not be able to use interventions at the undergraduate level because they require licensure to be able to do these things. It's a scope of practice that has to do with licensure, but it will prepare you for dealing with issues as an undergraduate working in an entry-level position, sometimes in case management or something like that, or working alongside a licensed professional in a particular setting using treatment planning. So it is important that we're familiar with these to be able to carry them out, even though we won't be able to develop them on our own. That's for treatment planning by a licensed professional. So we're going to talk about interventions today. Interventions are topics that makes you dangerous. That means that it's information that you have access to, but the information they have access to is something that requires adequate training in order to implement. You will have information without training. So it's important that you understand that you won't be able to really develop these on your own and implement them unless you're under the supervision of somebody who is licensed to do so. We're going to look at actual ways that we can help people, and this is more practical in nature than theoretical. Sometimes we talk about some theories that we can use to implement some kind of treatment modality, but the interventions are just how can we work with that individual in that moment to fulfill a need to feel better or to make change or whatever the issue is. So it's about the practice of that person's life and using an intervention in order to overcome some kind of deficit or achieve some kind of improvement. It doesn't have to be deficit based. It can be working towards something positive. So as the name implies, interventions are those things that get in between the individual and their problems. The key idea here is to intervene, to get in between, to come between something. So we want to find out what the issues are for the individual and work in the middle of those things in order to help the individual function better in the way that they are desiring. What we assume with interventions is that the individuals cannot do something on their own in order to feel better. There's something lacking there. Sometimes it's just confidence. Sometimes it's coping skills. Sometimes it's ideas. But sometimes it really is just, I don't know what to do, so please help me. And we can help intervene with those problems as well. So we assume that they won't be able to do it on their own, which is why we need to intervene. Interventions can be applied to many different types of problems, but in different ways. So if you have an intervention that is something like the client will have a more organized life, so if that's a goal, then we will help them to develop lists and things like that. We can help them develop lists for lots of different things, like lists of how do we help the person prioritize what they want to do the next 4 years at an undergraduate institution. Or it could be, how do we make lists that help them get through the day in an organized fashion? Okay. We can also talk about things as simple, air quotes, simple, as an exploration of an issue. What we mean by exploration of issues is there are some things that somebody may not know about that we have to explore to figure out to gather some insight. Think of all the different ways that we can use gathering insight as a way to intervene in somebody's problems. There are tons of ways we can do that. So we have to remember that an intervention can be used in many different aspects of the curative process. Ideally, when we are working with interventions, we're not really taking on the problem directly, although there are some cases where that's very appropriate to take on the problem directly. But we try to attack the underlying issue, meaning that we want to figure out what is going on beneath the surface that's leading to these problems, as opposed to just kind of solving the problems as they come up, or working toward a solution as they come up. You have to keep in mind, though, that some therapies, especially those that are like solution-focused, cognitive behavioral, behavior modification, are mostly outcome-based, meaning that for people who use those modalities or those interventions, they typically don't think too much about the underlying issue. They just want things to look good on the other end. The problem is that it creates an unstable foundation. That is, as soon as somebody starts to feel shaky, they don't have the coping skills to overcome it. And really, if you patch something up, it really only protects against a very narrow focus of threats to that particular issue that you've worked on. So interventions should attack the underlying issues in a way that allows you to maintain some kind of long-term positive coping mechanism as opposed to just patching it over. We are going to have a discussion in class about interventions, about when it's appropriate to look at the short term and when it's more appropriate to look at the long term. So be thinking about that. So in terms of treatment plan elements, the interventions are what we do to ensure that the goal is met. Something you have to understand is that interventions are things that the therapist will do. We'll work with the individual, but we'll be working with our clients to do something. And the skill that we have is what the intervention is based on. So if we are going to use something like ACT, acceptance and commitment therapy, then we need to use those interventions in order to help the person achieve whatever it is they're trying to do through the course of therapy. So we want to use those, for example, ACT, to achieve some kind of self-acceptance. The tricky part is that our interventions are going to be linked to billing. So, there's an email. Okay, good. When we are linking our interventions to billing, that means that we get paid based on how good our interventions are. Now, really, they're not going to go through and ask you what you're doing with the interventions, but insurance companies like to see that you're using some routinely used treatment interventions. That way they feel like you're working towards some kind of solution. That can be a constraint because oftentimes what they consider to be reasonable may not be reasonable. For example, somebody who's been dealing with depression all their lives might be expected to use some kind of behavioral intervention where they're going to list 3 things that they enjoy about life and do those things more frequently. Okay, fine, as if they've never tried that before, but the insurance company might require that because they think that that's what works. Insurance companies will always favor the short-term solutions because it costs them less money. So keep in mind that sometimes you can't have these long, drawn-out therapy episodes because insurance companies will limit what they will pay for. Either that or the individual has to pay out of pocket. That's why one of the benefits of working in private practice is that you aren't limited by what insurance will pay. Another thing to consider is the real time constraint. It's not just a matter of insurance billing, but if there are people who you know won't be successful in long-term therapies for whatever reason, whether they're low commitment or whatever, you can still use some interventions that are short-term, knowing that you'll be doing the best that you can possibly do. So, for example, a time constraint might be something like the therapist will facilitate regressive exploration related to possible attachment issues that make public settings uncomfortable. So if somebody has a hard time in public places, we might want to attack that issue very quickly because they need to function in public. So that means that we'll use that exploration thing, which can be a long-term duration thing, but we will do it in such a way that we kind of attack the behavior first. And if they do happen to hang on long enough to explore the underlying issues, then we will continue to implement that. But generally, we will use that exploration, so exploring things in the past that make them uncomfortable in public places, in the same context as coming up with a creative solution to where they're not feeling so, now my phone's ringing, to where they're not feeling so comfortable. Okay, so when we think of interventions, we can break them down into a few different categories. These are not the only categories that people have used to break down interventions, but they're pretty standard, and they will cover most of the types of interventions that you will come across. So those are cognitive learning, affective experiencing, and rehearsal. So that cognitive learning process is how do we rethink? How do we develop new mindsets? How do we develop new worldviews? How do we look at the way that we've conceptualized life experience? So the cognitive learning has to do with ways that we process the world around us. Affective experiencing has more to do with feelings. How have we integrated our experiences into our feelings? Are our feelings blown out of proportion for the way for what's going on? Not to say that they're wrong, but are they inordinate for what's going on? Is my depression overwhelming me? Is it along the same lines of what you would expect based on a situation like this? For example, if we're in a pandemic, it seems sensible that you would feel a little bit depressed because the way that you used to live life is not the same, and you might have some problems adjusting to it. And then rehearsal has more to do with practice. How do we practice new behaviors? We do this through role playing and things like that. So, if we're talking about cognitive learning, kind of those things where we're able to access the way that we conceptualize the world around us, there are some different factors that go into how we learn how to conceptualize the world around us. For example, there are some support factors. These are the things that lead us to increasing the way that we perceive and integrate the world around us. So catharsis, that experiencing a very strong emotion. Identification with a therapist, so finding somebody who can be a role model. Mitigation of isolation, getting out into public. Positive relationships, reassurance, all these things can be linked to positive outcomes using the support factors. So the learning factors have to do with what kind of information do you gather as a way to increase the positive outcome of therapy. So it's that advice, the rationale, insight, cognitive learning itself, feedback. So how can we learn to integrate those ideas into what we know by gathering information? And then action factors. What do we actually do? So action factors can kind of be linked to those rehearsal factors, where we're talking about what kind of things do we do now as a result of having some information and having what we need to feel confident in moving forward. So we do things like taking risks. Maybe we try something. Maybe I'm afraid to ask somebody on a date because of rejection. Well, taking risks could be linked to that. Cognitive mastery. So can I do something in a way that I don't have to really think about doing it anymore? It's kind of like an inside-out sentence. But am I able to do something well enough each time that I don't have to put a lot of thought into it? Are my behaviors regulated? Am I able to go out into public without feeling completely discombobulated? Or am I able to go out in public and with very little effort feel comfortable in reasonable situations like going to the grocery store? So the action factors have more to do with doing the action that's related to gathering information and having the support available to me. Excuse me. So we have to think about categories of affective experiencing too. So the affective experiencing, again, is the feeling or the emotion tied to the intervention that we're providing. So it's usually going to be emotional, physical, or a combination. So it's going to be an emotional feeling, like the feeling of being depressed. Or it could be the physical feeling of being depressed, like having low energy and things like that. Or it could be a combination of both. It could be an overt or covert combination of feeling. So you can have an overt feeling so people can see you. You can express a feeling of depression, for example, by walking slowly, carrying yourself poorly, just generally looking like what you would think somebody would look like when they're depressed. There can also be covert indicators or categories of affective experiencing, where on the inside you have a low metabolism, or you just don't feel motivated to do anything. And obviously there can be a combination of those things when we're thinking of what we can do to help somebody. So if somebody has a combination of overt and covert affective experiences, we'll have to create interventions that address both of those. It can be positive, neutral, or negative. Think of somebody who has like bipolar depression, or bipolar disorder, where they might be depressed and manic together, so they could have a positive expression of some kind of disorder. They could have a negative expression of disorder, and they could have a neutral expression to where it's kind of neither nor, usually in the middle of a cycle. if they're going from mania down to depression. Not only is the direction of the disorder something we need to consider, we also need to consider intensity. So if the feelings are very, very intense and they're inordinate for the experience, then that could be something that we address. On the other hand, we can have emotional experiences or affective experiences that are very low in intensity when they probably ought to be high in intensity. So if somebody is experiencing something very severe like a natural disaster and they seem to be taking it with very little emotional feedback, probably that's too low. There may need to be a different level of affective experience to reasonably handle the situation. Sometimes the level of awareness, whether or not people are aware or unaware of their emotions, can be what we try to intervene in. Lots of times people who are unaware of their anxiety might think that, or let me use a different example, mania. Mania tends to be one of those experiences that people feel really good about. So they don't always realize that they're in a manic phase. They feel like they can accomplish things, they feel pretty good, they feel like they have lots of energy, so they just mistake that for a good mood when it may be inordinate. So people may be out of awareness that they're having some kind of manic episode. And then they could be transiently in awareness depending on what's going on. Lots of times people will tell me, yeah, I think I've had a manic episode. And they said, well, or I'll say, well, what was it like for you? And they'll tell me that they were up for 3 days in a row, just, cleaning the house, getting things done. It was great. And yes, sure enough, they were having a manic episode. And it just depends on how aware they are of it. And hopefully we can train people to be more aware. So if there's a lack of awareness of a particular affective experience, then we can bring it to their awareness. That way they can more adequately address it. Sometimes we have to worry about whether or not the affective experience is appropriate for the context and stimulus. That can go along with level of intensity. Is there some kind of reasonable intensity for the given context or the stimulus? Or are people giving the wrong, quote unquote, are people giving an unusual affect for the given situation? Sometimes people will cry at things that are funny, or they might laugh at things that are sad. Lots of times that's a big red flag, because that means that they aren't having the appropriate appropriate measure of positive or negative emotional experience for that moment. That can also bleed into the idea of congruence. Congruence is the person congruently expressing how they say that they feel. So usually congruence means if I feel sad, I'm expressing sadness. If I feel happy, I'm expressing happiness. So it's a matter of whether or not the way they feel matches how they express it. And then last is helpful or harmful affective experiences. So when you're thinking of an intervention, how can we work with people in terms of their helpful or harmful behaviors and increase the helpful ones and decrease the harmful ones? So we have a lot of things that we just talked about here. I know that it was kind of a shorter lecture, but there's a lot that goes into it. Your responsibility is to look at the additional resources, look through the interventions, try to think about what kind of categories they're into. Are they hitting on the affective experience? Are they hitting on the cognitive experience? Or are they hitting on rehearsal? We need to make sure that our interventions are attacking the appropriate type of issues that are going on, using those categories as reasonably as possible. Now, for class time, think about how you might document this, but we're going to talk specifically about how do we use interventions as a way to talk about or to move towards some kind of resolution in the mental health functioning of the individual. So for next time, be ready to be able to write about that, but for class time, make sure that you're able to talk about the interventions, especially by diving into some of the additional resources and becoming familiar with them. Look forward to seeing you soon.